New at 6:30, as our summer heat hits, the ABC 15 investigators are digging into heat-related deaths. Just yesterday, we reported on our first this year. That's coming off a record 520 deaths in 2020. Investigator Courtney Holmes shows us why researchers say these deaths are preventable.
We know exactly why they die from heat.
To Liza Kurtz, heat-related deaths are a solvable problem.
It's making sure that people aren't exposed to those levels of heat.
But the equation became more difficult when coronavirus prevention measures had to be put in place in 2020. Kurtz is part of a team at ASU that studies the health and social effects of extreme heat in urban areas. She says cooling centers and hydration stations around the valley have reopened now, but last year,
understandably, many of our partners, to protect the health of their workers and their public, shut down during COVID-19.
The result? A record number of Arizonans dying from heat, both inside and out. According to a report released by the Maricopa County Public Health Department, of the 323 people who died from heat-related causes, 172 of them were experiencing homelessness. But that leaves dozens of people who were not in that situation, yet still died after heat exposure. Kurtz says their deaths suggest they somehow slipped through the cracks.
If you reach the point where you die from extreme heat, you have been failed by many other systems along the way.
One concern, air conditioning and the costs that come with it.
They're either not using it because they're afraid of the cost, or the air conditioning is broken.
According to the report, among the deaths where an AC unit was present, 69% of them were non-functioning. 31% of them functioned, but were not being used. While Kurtz says the full details of each death will take researchers years to put together, there is one part that is already clear.
Heat deaths are a diagnostic tool for where we're failing to take care of our most vulnerable as a society.
Courtney Holmes, ABC 15, Arizona.